Lloyd Austin remains in the hospital following complications from surgery for prostate cancer. According to the American Cancer Society, the number of men diagnosed each year with prostate cancer has grown since 2014. So this morning, we're talking with urologic cancer specialist and MedStar Health Dr. Nancy Ann Dawson on diagnosing and treating prostate cancer. Thank you for joining us. Good morning.
Good morning. Thank you for having me.
So before we get into the diagnosis and the treatment, it's interesting when we just said that more people have been diagnosed since 2014. Is that just because we're doing a better job of catching it? Is it more people that are actually going for screenings, or is the cancer more prevalent these days?
I think it's mostly that we're screening more again. We used to screen a lot, and then there was a whole period of time where screening wasn't being promoted, and I think people have figured out that that wasn't a good thing. So now we're diagnosing more because people are again being screened.
You know, it's one of those screenings, to be fair, that a lot of men are just like, I don't want to be a part of this. There are new ways to go about this. What do you suggest as far as somebody who is, maybe of a certain age or a certain demographic, a certain background, a certain family history? How do you recommend that men go about at least getting screened for prostate cancer?
So there's two things you really need to do. You need to have a blood test called the PSA test, prostate-specific antigen, and you need a digital rectal exam, whether you want one or not. Both together are the best chance of catching prostate cancer. The decision about when you start getting screened really is related to your risk. So African-American men have twice the incidence of prostate cancer. Men with brothers or fathers with prostate cancer, they should start getting screened when they're 45. Other people, a man with no risks at all, 50 or even 55 might be okay. But the more risk factors you have, the earlier you should be screened.
I know it's very tricky, right, because this is certainly a type of cancer where you might not get those symptoms right away in the early stages, because it's not like skin cancer. You can look down, you can see if there's a change to your skin. So what should men be looking for as far as possible signs if they have not yet been screened?
Oh, if you have early prostate cancer, you should have no symptoms. So the one thing you don't want to do is say, I have no symptoms, I don't need to be screened. You should be screened every year, and it doesn't matter whether you have symptoms or not. Most men with symptoms actually have benign prostatic hypertrophy, or they have prostate cancer that has already spread.
As far as those symptoms, though, is there anything in particular we should be aware of? And I'm only saying this is if this is men who have not been screened and maybe they're noticing some changes and they want to know, is this something that I should check out sooner rather than later?
Yes, if you're getting up more at night to urinate, if you have more frequent urination than you used to, of course, if you had blood in your urine, those would all be signs that your prostate cancer you potentially have prostate cancer, and potentially it has moved a little bit closer to your urinary tract system. Normally it grows towards the rectum, which is why it doesn't usually have symptoms. When it gets large, it starts giving you urinary symptoms, frequency, getting up at night.
Last question for you, Dr. Dawson, and I know that you're not treating the Secretary of Defense, so I'm not trying to ask you to talk specifically to his scenario, but one of the interesting things, apparently, as far as why he is still in the hospital is because of complications that arose. Is that common if you're being treated for the prostate cancer, that there could be complications like that?
Early complications are actually not common. When a man has his prostate removed, which is what the Secretary had done, they usually have a Foley catheter put in, and then it's subsequently removed. And most men do fine and don't have early complications. However, it sounds like he had a urine infection, and that went on to cause other complications.
Sure. Well, I appreciate
most men do quite well after surgery.
And that's good news right there, and good to hear for sure. Bottom line here is make sure to get your screening, and like you said, for men 45 and older, especially if you have any family history or any symptoms that you are certainly aware of. MedStar Health Dr. Nancy Ann Dawson joining us this morning to talk all about it.
All righty. That's a great interview there. A lot of good information there. All right, still ahead.